All right, Baltimore City Council Ways and Means Committee, we're back for fiscal year 2022 budget hearing. Specifically, we're here for City Council Ordinance 21-0080, ordinance of estimates for the fiscal year ending June 30, 2022. We're here this morning for Baltimore City Fire Department. I am Eric Costello, City Councilman from the 11th District, Chair of the committee. I am joined by Council President Nick Mosby. I am joined in chambers by Councilman Isaac Yitzi Schleifer, who will be vice chairing this for the morning session. Joining us virtually, Councilwoman Felicia Porter, 10th District, Councilman Robert Stokes, 12th District, member of the committee, Council Vice President Sharon Middleton, 6th District, member of the committee, Councilwoman Danny McCray, 2nd District, member of the committee, Councilman Mark Conway, 4th District, Councilwoman Odette Ramos, 14th District. Joining us on behalf of Mayor Brandon Scott is Natasha Meehue and Nina Themlis. Joining us on behalf of Council President Nick Mosby is Matt Stegman and Nikki Thompson. Staff to the committee is Marguerite Curran. Joining us in chambers today is Chief Niles Ford and Special Assistant to the Chief Roman Clark. The rest of the fire department is virtual. Chief Ford, I'm going to ask you to instruct all of your personnel that are on this call to turn their video cameras on. We're also joined in chambers by Bob Seneme, Budget Director from BBMR. So if we could have everyone from the fire department, please turn their cameras on, and as well as council members. And as soon as we get those cameras on, we'll get started. We got a couple more folks. As soon as we get those cameras on, we'll get started. All right, well, that looks like critical mass on the cameras getting turned on. All right, Chief Ford, you have a presentation. I'm going to ask you to keep your presentation somewhere in the 20 to 22 minute range. If you could please pull it up and we'll get started. Take it away, Chief.
Yes, sir. Thank you, Mr. Chair. Okay. Does everyone see that? I'd like to outline each fire administration number. Each physical number, service 600 fire department, fire administration in particular. That's the one that oversees leadership, direct support, the function including budgeting, fiscal operations, procedures, accounting, information technology, human resources, workers' compensation, expenses, diversity awareness, and general administration for all practical purposes. Includes HR, finance, personnel, the leadership team. The recommended budget funds, the replacement of programs for radios and mobile data terminals. Our MDTs are at the point where they're at the end of life cycle where they need replacement. Also, budget funds of $110,000 in renewal costs for certain mission critical software applications that the fire department uses. Furthermore, this budget supports $1.6 million and $350,000 in allocated federal and state grant funds, respectively. Priority outcomes for building public safety, service number 602, fire suppression and emergency rescue. Of course, this service is 24 hours, 7 days a week response organizations. This is the one that does land and marine fire protection, emergency medical services, emergency rescue, and hazardous material removal, dispatched over 320 individual unit responses. That's not 320 calls. 320,000 calls. That's 320,000 units that actually respond for those calls. The agency recorded the lowest number of civilian fire fatalities, total 7 last year, 2020. That's the lowest in the history of the fire department. And for all practical purposes, that was done through an aggressive and proactive process of smoke alarms, performing safety sweeps, informing the community, doing community education, including for all practical purposes, fire inspection, as well as plans reviews, fire and EMS response, fast response, and effective response. The recommended budget also includes the final year of the 3-year SAFER grant that will support the number of individuals that would occupy 2 fire companies, and the required match is 25%. $608 emergency management service. I do have the emergency management director here at this time. I'll go over this slide, but he'll be here to answer any other questions beyond this point. This service prepares the city for major emergencies, such as hurricanes, power outages, hazardous material incidents, and acts of terrorism. The service manages interagency and public-private sector programs to mitigate against, and plan for all hazards. The service is also a 24/7 field response, citywide coordination for incidents and events that are high risk, prolonged, widespread, or complex. In 2020, this service also provided emergency medical support for COVID-19 response. Baltimore City Office of Emergency Management and the Emergency Operations Center has been fully activated since April 2020 in response to COVID-19, making this the longest activation in OEM's history. OEM is a partner in managing the CARES and FEMA public assistance funding and reimbursement. OEM facilitates weekly financial recovery meetings, compiles documentation for the city's COVID-19 response activities, and manages the city COVID-19 supply warehouse. Service number 609, emergency medical services, fiscal 2022 recommendation of $55,720,000. This service provides 24/7 response assessment, treatment, and hospital transport of trauma and medical patients. The EMS division responds to over 150,000 incidents per year and transports over 100,000 patients annually. The budget supports the ET3, which is emergency triage, treat, and transport model, a 5-year Medicare and Medicaid payment model. ET3 will feature triage decisions, treatment in place, intervention, and transport to alternate destinations. The budget maintains funding, excuse me, for 26 full-time EMS units, 24 hours per day, and 10 peak units. 1.1 million of CARE Act's provider relief funds will be used to support EMS personnel through December 2021. Excuse me. The budget includes $19.8 million in general fund savings due to EMS fees collections on eligible ambulance rides. EMS fee revenue is collected in a special fund and offset by general fund costs. Building Public Safety Service number 610, Fire and Emergency Community Outreach. This service provides outreach and education to the city residents, to the businesses and visitors, and fire safety and emergency medical service prevention. BCFD Outreach and Special Events Division desires to measures to measure the number of youth, and that's ages infant through 19, that receive various fire and life safety activities. These activities include, but they're not limited to, inspector detectors, elementary school children in grades 1 to 3, summer youth, fire and life safety camp, children ages 8 to 14 rather, child safety seat checks, events attended by suppression units, and recreation center visits. The number of non-city sponsored events accommodated declined in 2020 because of COVID-19. 611 Fire Code Enforcement. This service reduces the likelihood of fires and ensures that buildings meet safety regulations. This service includes building inspections, plans reviews, and fire safety equipment testing for 5,852 multifamily dwellings, 11,385 rental units, over 83,000 single family dwelling units, and over 13,000 commercial businesses. 612 Fire Investigations. This service investigates and tracks the cause of fires in order to focus fire prevention efforts, issues products recalls, and prosecutes arson crimes. The Fire Investigation Bureau investigates about 410 fires in fiscal 2020. The percentage of fires that are determined to be preventable is determined by the incident commander of the fire scene. If the incident commander can determine the origin and cause of the fire, and the fire is not classified as an arson, a fire investigator is not needed. Should the incident commander have problems determining the origin and cause of the fire, or the fire suspicious in nature, a fire investigator is responding to that scene. 613 Fire Facilities Maintenance and Replacement. This service is responsible for maintenance and capital projects, oversight and planning for over 40 BCFD buildings. The Fire Apparatus Coordinator's Office manages maintenance and repairs for over 350 pieces of apparatus, fire and EMS supply personnel, and millions of dollars of emergency response related equipment, personnel protective gear, medical supply equipment, and drug inventory. The recommended budget includes $1.54 million from Federal Assistance of Fire Grants, AFG, to install vehicle exhaust removal systems in all stations. This system is a significant step for health and wellness of employees aimed at cancer reduction. The budget also includes $1.4 million in Amos State Grant Fund. The grant will assist with the purchasing of equipment and vehicles. The funding also allows the department to do some renovations of facilities in fiscal 2022. The fundings will be used to perform complete renovations of 2 fire stations. 614 Fire Communications and 911 Call Center. This service processes approximately 1.4 million fire, EMS, and police 911 calls per year, and dispatches and monitors approximately 190,000 fire and EMS incidents annually. The service includes 24/7 staffing and emergency communication center. Of an emergency communication center's rapid assessment for appropriate emergency dispatch and real-time remediation guidance for callers. The city will submit legislation to increase the 911 fees by 25 cents per line. The increase is enabled by the Next Gen 911 legislation passed by the General Assembly in 2019 that allows local jurisdictions to increase their fee, and if the current revenues do not cover the cost of 911 services. 615 Training and Education. This service tests and trains fire academy recruits to maintain staffing levels and promote a workforce whose diversity reflects Baltimore City. This service also provides continuing education, professional development, and skills enhancement for existing suppression and emergency service personnel to reduce the number of line of duty injuries and illnesses to personnel and citizens, and to reduce the city's financial and legal liabilities. The training academy is projected to train 3 to 4 classes in fiscal year 2022. The number of classes may vary by year and is determined by the eligible number of recruits. Mr. Chair, that completes my presentation.
Thank you, Chief Ford. We're joined chambers by Councilman Chris Burnett, 8th District, member of the committee. Also joined by Councilman Ryan Dorsey, 3rd District, member of the committee. Okay, that's everyone. Council President Mosby. Okay, Chief Ford, I have a couple questions, just one for now. You mentioned this was the second longest activation of OEM. What was the first? You're on mute. No, sir.
I believe this, I'm sorry, I believe this is the longest. If I said seconds, I apologize.
Quite fine. Thank you, sir. Colleagues, start to get into questions. We're going to strictly adhere to the 2-question limit. We're not going to be, this is day 5 of budget hearings, so we're not going to be doing speeches today. So if it's going too long, I'm going to respectfully ask you to rein it in and focus in on what the question is. We're going to go through committee members first. We'll start with those members in chambers. We'll start with Councilman Schleifer, and then we'll go to Councilman Burnett. Councilman Schleifer.
Thank you, Mr. Chair. First off, I want to thank the men and women of the fire department. They do excellent work. Every scene they're on, they're extremely professional, risking their lives to save everybody else. And so I can't express enough thanks to the work that they do every day. My first question for you, Fire Chief, is what is the biggest problem that the fire department currently faces?
There are probably 2 significant problems that we're facing right now. One deals partly with staffing, and another deals with infrastructure, and infrastructure includes facilities and apparatus. And when I speak of staffing, the staffing dynamic is also partly driven by some of the COVID challenges we have in the hiring process. Also partly some of the same challenges all the other fire departments have in the country, and other policies that are in place that sometimes make it difficult to navigate.
So why doesn't this budget reflect those needs? So when you talk about policies, you're the fire chief, you can change policy pretty easily. The staffing issues you talk about, I think it's clear to everybody that there's EMS staffing issues across the city. And when I look through this year's budget, I don't actually see those issues being addressed. I mean, what I do see is under number 600 for the fire administration, I see that there's an additional $585,000 in your budget that is adding an additional position to the executive team. I'm not sure what that $126,000 position is, but can you talk to why this budget doesn't reflect the changes that are necessary?
Sure. And I should have been probably more clear when I said policies. There are certain processes in respects to the MOU that we have to go through. It's not necessarily so much policy. And yeah, I could argue in the offliner that some of it is, but there are MOU issues that we have to deal with that are just unfortunately, part of just doing business. Um, in respects to the facilities, we have a long list of issues in the facilities, and that's part of the reason why we're turning some of our AMIS funds toward the facilities. The additional position that I think you're talking about is the equity officer position, and that was a needed position, a very important position, something we really needed, and that's the reason why that one was put in place. But we have a recruit class that will be graduating within the next month or so. We suspect to have another recruit class going in specifically dealing with EMS and both basic and paramedics going in soon. They've already gone through their physical agility test. And we're about to test for EMT firefighters soon. So we expect to resolve that issue pretty soon. We are up around overall in the department, I think right over 5% vacancies, which we try to stay around 2 to 3%. That's something we've been working on for the last 3 or 4 years. But because of some of the bumps we ran into with hiring during COVID, it kind of pushed us back a little bit.
Well, you only answered part of that. So you said that the $126,000 position was the position, which most agencies that came through here just appointed somebody on their team to oversee equity within their agency. But if you guys created a new position for that, I guess that's your prerogative. But can you just elaborate on what the rest of that money was for? The $150,000, the $550,000 additional money for the administration for the fire?
Yeah,
Councilman, before the chief asks that, I'm just going to ask you to go back and reframe the part of your original question that you didn't answer. Reframe that for me without context in one sentence, please.
We were just talking about the challenges that they face, and so when I got to the budget line item of 600, that gives $585,000 additional money for the administration. You answered $126,000 of it. I was just wondering what the rest of that increase was.
So you want to know, okay, so the delta between the 126 and what the increase of, what was it?
585.
585. Okay, chief.
Councilman, if I may, on this one, there's an exhibit in the budget publication on page 119 that shows for every service the difference between last year's allocation and the fiscal 22 allocation. So that's probably the best reference point. Remember that some of those increases are what we would call more fixed costs, things like workers' compensation, rental, health benefits, et cetera. So if you look on page 119 of volume 1, there's a list of the changes from year to year. And
yeah, so those changes equal $10 million.
No, they don't. It goes from 9.5
all the way at the bottom, 10,135.
No, that's the fiscal 22 budget. It starts at 9.5 million in fiscal 21, and then the changes get you to the 10.1. So yeah, it's about $500,000 to $600,000.
Right, and so
the list of the things. The list of the things in that column, you can see, transferring a position or, reclassing a position are listed on the right-hand side of what changes from year to year.
Okay, and so I'll calculate each one of those items there to see how we get to that difference. But in follow-up to that, and I guess this will be my second question, you had mentioned that you're turning EMS funds into facilities, and so is that the best thing to preserve life and safety in the city to further deplete an already depleted EMS unit?
Councilman, you cut out there. You said converting from life safety to something, and then you cut out.
So my follow-up question, am I on? My follow-up question, you had mentioned that you're turning EMS funds into facility funds. And so I wanted to know, is that the best best decision to preserve human life in Baltimore City to take funds that are designated for EMS and putting it into facilities as opposed to coming up with a different plan to improve the facilities.
And Councilman, I'm sorry, I might have misstated if I said that. I was talking about Amos funds. Amos funds, what we've been historically using Amos funds for is to purchase apparatuses, and I'm basically shaving a portion of those funds off to try to fix facilities because our facilities need some attention.
Okay, and so just my closing piece on that is that I think that the EMS unit needs that attention. I would say more than just about anything else because the response time is critical to saving lives. You know, when we see, I've been on shooting scenes, homicide scenes, and when the response time is quick, those lives are saved. When the response time is slow, more often than not, those people end up passing away. And so that is something we should look at a little bit more. But I will turn it back over since I only get 2 questions.
Thank you, Councilman Burnett.
Thank you, Mr. Chair, and good to see you, Chief Ford, Chief Clark. So first question, well, one, just wanted to thank you all for allowing me to join the cruise on Saturday. I went out and did the fire safety canvas in the St. Joseph's community, which I thought was incredibly eye-opening. It wasn't my first time out there, but first time in a while to go canvassing and talk to people about fire safety. But it was also just a little bit disappointing to see how few people or how many houses we actually went to that did need assistance in the fire department with smoke alarms. Can you just speak about that work, that sort of community education and direct outreach work and the impact that it's having, and also how we can try to grow that potentially, because clearly there's some folks that aren't getting the message as it relates to the need for smoke alarms that work and that kind of thing. I think you're muted, Chief.
Sorry. Gotcha. Thank you very much. I want to thank you for that question, Councilman Burnett. I also want to thank you for coming out on Saturday. I know how committed all the council members are to going out in the community and being seen in the community and participating in the needs of the community, but also the attention that's paid at that point. Then my members see it as well, and it's encouraging to them as well. That program is one of the programs that, to me, put us in the position that we were able to go down to 7 fire deaths last year, the lowest number, like I said, in the history of the fire department. And it's yeoman work that our people have been doing for a while. So it's not something that we caught in lightning in a bottle. It was a process where our people have been working at this for years. So it does pay fruit. I'm not naive about the fact that the stats are going to be ebb and flow, marginally up and down, but I expect for us to continue to reduce because of the commitment that our people have. It makes a significant impact. We moved from several years ago from quantity to quality, meaning that I didn't want our folks just to have numbers and say, well, we installed 200 smoke alarms on a certain day. I wanted them to develop relationships in the community and to teach people fire safety. So that's one of the things they've been focusing on. And the challenge that you spoke of is that some of our community misinterprets our arrival to their house. We're not trying to write citations, and we're not there as a element to focus on anything other than their safety during fire, or any other help that we can offer to them at that time. And sometimes individuals do not necessarily let us in. And I really wish they would, because our goal is their safety, and that's it. And while I'm on this, before as I bring it to a close, to everyone that's listening, I want to remind them that if they call 311 and tell the 311 operator that they want the fire department to come out and install smoke alarms, we will have someone come out and install free smoke alarms. The smoke alarms do not cost. Thank you. I hope I answered your question.
No, it was a good reminder for folks. And the other thing I wanted to chat about was, so on the safety walk, I actually got to go with one of the firefighters who actually came through that high school pipeline. Can you speak a little bit about, which is great to see, a graduate of the program on the street in the community. How can we grow that pipeline? Can you talk a little bit more about, I know we've had a few hearings about it, but for the folks watching in the budget world, can you talk a little bit about that pipeline from high school into the department and some of the things that we need to expand that pipeline to make it even more effective than it already is?
Yeah. And I think I know the young lady that you walked around with. She actually was if it was a young lady, I think she was actually in the first class, recruit class that we brought through. And she's at this point now, she's challenging for promotions. So she's looking at becoming a driver, or even a lieutenant for that matter. It is an outstanding program, one of which our commitment is to grow it. In fact, one of the areas of strong diversity that we have with that group is we have an opportunity. We brought in young ladies into that group in large numbers. In fact, we have more young ladies in that effort more than we have gentlemen. So what we're looking at doing now is, and Chief Shiloh is out of training, and she's championing this. We've gone through a few bumps in the process of the program, and we're building a relationship right now with the state of Maryland's apprenticeship program, which will give us an opportunity to work with the young people year round and in a little bit more aggressive fashion. Some of the challenges that we've had historically is a few: getting the word out that the program's there, explaining to young people. A lot of times young people say that they don't want to be in the fire department because they don't want to run in a fire building or something like that. Well, first of all, we have more than firefighters. We have EMTs and we have paramedics, people that are there to save people's lives. But the other thing is, once they start doing it, they realize how enjoyable the job is. And many of them go ahead and say, I want to be a firefighter. So we need to open the door and open their minds to the possibility. As far as my opinion, the best kept secret in the country is the fire service. The best job. An individual can come into the fire service and go into a middle class pay status almost instantaneously, almost with a high school diploma. It's challenging work. I think the biggest thing that we need to do is get the word out and really get participation in the way we need to get participation. It is. I'm passionate about everything we do, but because I'm so passionate about young people, this is a cornerstone for me, because I know how this can transgenerationally change lives and families for years and generations to come. So the biggest issues I'll go back to it is getting the word out of the program, the importance of the program, and that as I said in our diversity, and as we had introduced our LGBTQ liaison, everyone has a place in Baltimore City Fire Department, and we need to get that word out. Thank you.
And I don't have a question, Mr. Chair, but if we could, Chief, or third question, I've asked one too, but a request I would have is if there are communication materials that the council can help push out, if you could get that to the committee, we can try and make sure our colleagues are pushing that out as well on our platforms. Thank you, Mr. Chair.
Absolutely. That would be very helpful. Thank you, sir.
Nina, can we add that? Do we know what number that is? 55. Outstanding. Councilman Burnett, you good? Thank you, sir. 1 second. Council Vice President Middleton.
Thank you, Mr. Chair. I guess first, I just also quickly just like to thank our first responders, the fire department, for the work that you do, especially the problems that we have been having through COVID. You have definitely been there. And a shout out for the, the fire smoke detector program. It's just a wonderful, we have the best in the country as far as that program. I am so glad that that is continuing. And then just another thank you for the response that you gave on the 2 explosions in Northwest Baltimore. Partner with my councilman of the 5th district on the problem, the explosion that happened on Lanier and Lambeth. In those areas, you were phenomenal, fire and EMS, and we just can't praise you enough for that work. And just to add to, I know that I was, when you were going over your things and places that you visit, please include the senior centers, because I see your presence there at the one in my district and some other places, and that's just so very important that that is part of your documentation. My 2 questions, this first one, basically, thank you, Councilman Burnett, for your questions on basically the recruitment effort with the fire department. And Chief, and you did mention the your recruitment for females, which is very important for this city. And my question for that one is, how many females have you promoted this year, or if any? You're still on mute.
Okay, thank you. This year I would have to look at the number, and before we get off this call, I will try to make sure I have that information.
Okay. Yes, please send that to us. And
Madam VP, hang on 1 second. Nina, can we add that as number 56, please? Thank you, Madam VP. Floor is yours.
And again, just to add, thank you for being a part or getting reconnected with the state apprenticeship system. There was a disconnect many years ago, and making that connection again, I think is so important for the city. So my second question has to do with, that our city is still in a terrible opioid epidemic. And I know that your response team efforts is giving that Naxalon, and and I've had conversations with firefighters and EMS that sometimes we're doing this 6-7 times to the same person. Do you collect data on the amount of Naxalon that you give out? And I just kind of think that those numbers are important right now, so we can see really, it's another way of showing and seeing how bad our epidemic is. And it's also because of that constant back and forth, that's traumatizing to our EMS and firefighters. So connected to that, are you having trauma training with your employees?
Okay, Councilwoman, for your first question, I'm going to start speaking, but I'm going to ask Chief Matz to chime in as well. In comparison to, we give a large number of doses of Narcan. We do, and yes, we track it, and we are actually setting up more systems to track it more closely. Chief Matz, can you speak on that for me?
Yes, sir. Good morning, Chairman Costello, members of City Council. On average, over the last few years, we spend roughly $1 million a year on Narcan. Narcan costs about $37 a dose, and that equates to about 27,000 doses of Narcan per year. We're actively in a partnership with the health department on the opioid intervention team, helping them get the word out and see what we can do down at the street level. We're also working on a program with them where we do leave behind Narcan. And I'm just waiting on an update on how many Narcan kits we've left to date. But essentially what we do, if we go on location and there's been an overdose, or we've actually brought somebody back around, we'll actually leave up to 3 doses of Narcan, 3 kits behind if requested so that they can help. And quite honestly, the word's starting to get out there. Some of the reports we're getting back from the Leave Behind program is that they're administering Narcan before our arrival, which is actually helping. It's a lot easier to fix somebody before they get to the point where they stop breathing. If you give me just a minute, I'll go ahead and give you a total on those leave behind numbers.
Yes, that data is so, I think is so important for us, and it will help us narrow down communities that really have a problem, connect with the health department, and it will show how, and give us ideas and, just forward thinking of ways we can help certain communities within our districts that have this, serious problem. I make this announcement at the end of every council meeting about our opioid epidemic, and I think it's time we start getting real concrete numbers and data to just really help to really destroy the epidemic. So if you can somehow get us those numbers to Mr. Chair, I would appreciate that.
I have them. I just got them. Since the inception of the program, we've left behind 1,931 kits, which equates to 3,862 doses of Narcan. We also daily share data with the health department to track it. They have a system where they're tracking for hot spots and such, where they go down into the community level to target those areas.
So you said the health department has a system to track that?
Yes, ma'am.
Okay.
We share it on a daily basis with them. It's done by census group and tracks, and what they do is they'll target it with outreach teams. A lot of their outreach teams are recovered users that they help one-on-one with, and they target those areas.
Thank you. Mr. Chair, can we get that data too from the health department?
Yeah, I want to summarize what that specific request was, though. And before we get there, I got a follow-up question. Is that data available publicly?
As far as number of doses offered,
Yeah.
Chief Matz, I don't think we publicize that.
No, we don't, and we could publicize that, but we can't publicize the actual target areas because it gets through a lot of HIPAA.
Hang on, Chief Metz. Or you went a little fast for me, if you don't mind. Still early in the day. Thank you. You said we can publish it, but
the data has to be de-identified because it's health protected information. I can't narrow something down to like 1, 2, 3 any street because you'll be able to figure out that so-and-so person was an overdose. It gets into health protected and HIPAA information. A generality like how many doses of Narcan we would use or leave behind kits or a particular zip code, that's okay, but we can't get down in the weeds with real tight identifiers where you can figure out who it was.
let me ask you, can we go more or less granular? For example, less granular being, say, one of the 9 police districts versus more granular being the radius of coverage of a specific firehouse?
I believe the way the health department reports this out, and this does come from health, it's usually by neighborhood. They use it by, like, let's say Ashburton or something to that effect down to those small districts. They don't use police districts or firehouse districts.
Right. Okay. And then by when we say neighborhood, we mean like larger, like census tract neighborhood, right? Not how most of us refer to neighborhoods in the city, but like, for example, the council district I represent has 25 neighborhoods, but there's only like 7 census tract neighborhoods in it, right? Because it's much larger.
Right.
That's what we're talking about, right?
You're talking sensor track is what they use for the most part.
Okay, okay, all right, so let me go back, just Madam VP, if I could just go back from the top, just make sure I understand this. So you're asking for, well, let me turn it over to you, Madam VP. Summarize the data request in one sentence for me, please.
So I think it's important for us to have the data in area, Park Heights for me stands out in my mind, and we know that it's
But Madam VP, if I may, I understand where you're coming from and agree with you. I'm saying,
Right.
what is the specific data we want? We want the number of Narcan kits
Yes.
that are deployed, or?
that are deployed in the particular neighborhoods. That's good enough. And
Okay.
that's gonna, Mr. Chair, and I ask that because I think that's gonna help. That's gonna help neighborhood associations. That's gonna help nonprofits that work in those areas to hone in with data, ways to help.
Right. No, I couldn't agree more. So Madam VP, interrupt me if I got this wrong, because I'm gonna further clarify on that request. So we want the number of Narcan shots used per neighborhood, right? And Chief Metz, can we, this is a question for BSIT with open data website. Can we get that? Can we start to put those data sets online?
I believe Mike Freed from the Health Department is actually working with something of that nature. Like I know, for instance, last month in May, we gave 40 kits. Remember, every kit is 2 doses, so actually 80 doses we left last month. So, but I don't have it by neighborhood at my fingertips. I have to go research that piece.
So when we say we give out a kit, we're talking about we've distributed a kit. That kit hasn't necessarily been used, but each kit contains 2 doses.
Correct.
Okay. All right. So okay. So what I'm hearing is that the fire department has no objections
Right.
to the health department publishing that data for public consumption.
None.
None. Okay, perfect.
The only, I'm sorry, Mr. Chair, the only concern is making sure that we don't violate any HIPAA considerations. No, we don't.
So if we're just publishing the number of kits distributed
Yes.
per neighborhood, like census tract neighborhood, over a given period of time, you have no HIPAA concerns, correct?
None.
Okay. All
And
right, Chief Matz, you heard what the chief said, that all makes sense. You're good with that, right? Because it sounds like you're the lead on the fire department side of this.
Yeah, on that side, I work closely with Jen Martin from Health for that. So Mike Freed and Jen Martin from Health, sure.
All right, let me go back to the VP for a second.
And these are the numbers, you're also including the numbers that are being used, right?
No, ma'am, these are separate from usage. This is just for the leave behind. Our usage, as our providers respond to a location and administer, we average about 27,000 doses a year that we administer.
Okay.
Give or take, it goes up and down, but I think actually, from what I'm understanding, that there's been an increase in opioid usage due to the pandemic as well. So.
Okay.
Mr. Chair.
This is a good start because it's also going to show how hard your force works, not just putting out fires, but all these other you're involved in all these other systemic problems that we are having within our communities, and I want to help to show how hard you work in our communities. So thank you.
Just to close the loop on that, Chief Matz, do we also have data on doses that are administered by fire and by health?
Yeah, we work with Health daily and publish that data.
Okay,
we
but
transfer that data to Health every day.
All right, can we get that data published online, so kits distributed as well as doses administered. Do we see any issues with that? And that would be by census tract neighborhood?
Exactly. As long as it's de-identified by census tract, it shouldn't violate anything. It's got to be, like you said, by census tract, but that shouldn't be a problem.
Okay, excellent. So what we're gonna, go ahead, Chief.
It's on a different issue.
Okay. So I think what we're gonna ask for is for a written plan, right? Nothing long. We don't need a book report, just a couple sentences, which is a joint response from the fire department and the health department, which outlines the plan to make the following two sets of data publicly available on Baltimore City's open data website. The first is number of doses distributed by census tract neighborhood, and then number of doses administered by census tract neighborhood. Everyone good with that? Madam VP, we're
You
good?
nailed it.
Thank you, ma'am. Nina, can we add that one? So that's just going to be a written plan that can come from the mayor's office of government relations, but that'll be something, just a couple sentences explaining. We understand the council's request. We think that we will have this online on Baltimore City's open data website by this date, covering this period of time, et cetera, by no later than whenever. And that would be approved by both, I'm going to assume Chief Metz is going to be the person to approve it on your end. And then I think we said Jennifer Martin over at Health Department, although she can get it to whoever it needs to be approved by over there.
Okay.
Good?
Yes.
All right, excellent. So Chief Ford, you had something else you wanted to address with the Council Vice President's comments?
Yeah. I wanted the earlier question, we promoted 2 females sworn and two civilians have been promoted in the fire department. That's information directly sent to me from Captain Robinson. Also, it's good that you brought up the post-traumatic stress issues in the department. This is PTSD Awareness Month. It's a very important issue in the fire department and public safety in general. And Ms. Vice Chair, you're absolutely right. Our members have the unfortunate opportunity to see a lot of things that they have to digest. Approximately 4 or 5 years ago, I believe that labor management partnered together to establish actually our first EAP because of PTSD. And we put things in place in order to make sure that our members have an outlet of professionals who can assist them and even assist their family members for that matter. We also have peer counselors inside the department as well, who do an outstanding job for their brother and sister in arms in this calling. So it's very fortuitous that you brought it up, because I'm glad we brought attention to PTSD, and this being PTSD Awareness Month.
Thank you for your answers, and again, thank you, first responders, for the work you do in our aging city. Thank you, Mr. Chair.
Thank you. We're going to jump to Councilwoman Porter because she might have to jump in a little bit, and then we'll get back to committee members. Councilwoman Porter.
Sure. Thank you so much, Mr. Chair. Chief Niles Ford, I just want to commend you and your team with the just wonderful execution in District 10. We've had significant fires over the past 6 months, and so I just wanted to shout you all out and thank you all for all your wonderful service. I did have one particular question. Hopefully you see this coming. Related to Engine 55, particularly line item 602, fire suppression and emergency response. You mentioned that the fire department has a 3-year SAFER grant that would support 2 fire companies. Have you all determined who those fire companies are?
As in respects to disbanding, is that what you
No,
mean?
so I'm looking at your presentation. It said the recommended budget included the final year of a 3-year SAFER grant that will support 2 fire companies and required a 25% match of city funds in the first 2 years of the grant and a 65% match of city funds in the final year.
Yeah.
Have you all determined who those 2 fire engine companies are?
They are not necessarily any particular engine company, or it's when you apply for the SAFER grant, ma'am,
Okay.
you just apply for a number of individuals, and we applied for 40 positions. That's the equivalence of 2 units. So it could be 2 units anywhere
Okay.
in perspective. We also applied again this year as well for
Okay.
the SAFER grant. So it's not that's the reason why I asked that, because you brought up engine 55, and I thought that's the direction we're going. And I will kind of speak to that. We haven't disbanded any units. We're still waiting for assessments being done from facets, and we're waiting for the final report.
Okay.
Okay.
And do you have an idea when that final report would be done, or?
It should be very soon.
Okay.
I was actually expecting it by now, but
Okay.
there is a large portion of it dealing with facilities and some statistics that I know we're working through. The facility portion is probably 80% of the report.
Okay. All right. Thank you so much. My next question actually has to deal with, similar to Councilman Schleifer's question related to EMS medical service, particularly line item 609. Have you all thought about a sustainability plan after, I believe it was, let me see, used to support the $1.1 million of CARES Act provider relief funds will be used to support EMS personnel through December 2021. Have you all thought about a sustainability plan for EMS support after 2021?
Yes, ma'am. I'll let Chief Matz, can you start speaking on that, and I'll come behind you, because we in fact we talked about that this morning.
Okay, good. I'm sorry if it was in your presentation. My apologies if you said it.
No, I'm not. No, I didn't say him. I'm talking about. I spoke to Chief Matz this morning on the phone about this.
Oh, okay. Okay, good.
Hi, good morning. Well, there's a couple angles here that we're talking about with regard to sustainability. First and foremost, we talked about our personnel and our mannings. Obviously, we have a class coming through sometime this summer to help refill some of our positions of EMTs and paramedics. During COVID, it was very difficult to bring classes in. Actually, most of the colleges and our local feeder pools that feed paramedics and EMTs to us actually had to suspend a lot of their operations because of COVID concerns. Students couldn't ride along on units, doctors couldn't ride along on units, and we're just starting to relax that now with using no more than one person at a time. We're also doing a bunch of innovative strategies to try to get our patients to go to the right resource, the right patient to the right resource. A good portion of our patients that we transport every year, probably 30%, really could get appropriate treatment at an alternative destination like an urgent care center, the stabilization center if they have an alcohol or an opiate issue. And we're actively working on programs with that right now. Chief Ford had alluded to some of that earlier. One of those programs is the Mobile Integrated Healthcare Community Paramedicine Program. And that's a program that we started back in 2018. Let me just get my notes for you. Basically what it was is we did a partnership with the University of Maryland, and basically it funded 2 programs. It was a 2-year program through the HSCRC. It stands for Health Service Cost Review Commission. They're basically the people that pay the hospitals. Maryland is a unique state where money is fed directly to the hospitals. And if the hospitals do their work better, smarter, and more efficient, they get a bigger profit. So basically HSCRC feeds money to University of Maryland, and we stood up 2 programs. Part of those programs, one was a transitional program where we help patients to transition from hospital to home setting. And basically what it was a multidisciplinary team that includes community paramedics, which are paramedics that have additional training, nurses, community health workers, EMTs, social workers, and pharmacists. And I'll use the term ALPs, which are advanced level providers like nurse practitioners and physicians as well. And that team basically uses evidence-based and a modern approach where they actually go to their house, through the use of technology, improved workflows and screening tools. They basically provide a robust patient-centered support to patients in their home. And when they go into the home, they actually do a full assessment of the patients. They do a social, a functional, environmental, and a pharmacology reconciliation to evaluate where the people are, both in their health literacy as well as their living conditions, and see where we can, peck away at some of the problems and try to help some of those problems. It communicates to the operations that are basically, if we go on location, we identify, say, 8 issues, maybe your wheelchair or walker's messed up. Most patients, and a large percentage of our patients, have a lot of pharmacology. That's like the most common problem that we identify. In the beginning, I think one of our very first cases, we had a diabetic that was discharged from the hospital home. They were given insulin, but no needles to administer the insulin. I mean, stuff like that happens every day. So basically what we do after 30 days and then do intensive treatment with these patients, we do a soft handoff to a primary physician or an FQHC, which is like a center. Let me get the latest stats for you for that program. That program actually has been really successful. We were averaging about 40 to 45 patients a month. Now understand, because of COVID, things dropped. We're more like 30 to 35 because of COVID, because a lot of people were afraid of us to come to the house too. So there was some of that as well. As I said earlier, most of the problems that we find with doing our assessments are medication related. Actually, it's about 92% of the cases we find have medication errors. The next 2 largest things that we identify when we go into people's houses are coordination of care issues, like how do I get you a right doctor? How do I get you transportation and such? And the third is DME, or durable medical equipment. It's like wheelchairs, walkers, something like that they might need. Most of the medication issues, I mean, there's a whole list. I don't want to go through them all. The highest thing by far is missing medications. One of the other problems that we did identify, for instance, we had a patient that kept passing out or losing consciousness or getting woozy. And basically what they found, the patient went to 3 different physicians and ordered the same type of medication for blood pressure. This patient was actually taking 3 times the blood pressure medicine they should have been taking. Meds have different names, but they're the same medicine, like metoprolol, atenolol, propranolol. They're all the same medicine, but somebody that doesn't in medicine doesn't know that. So that was one of the easiest and lowest hanging fruit that we could take care of. We have also, because of the requirements of the AAA, we have to calculate patient satisfaction, and then I'll move on to the next program. This program for the last year has had a 9.8 out of 10 for a satisfaction survey from the patients where we're going in their house. So it's been very successful, been a very successful partnership. The second program, it's called by 2 different things. And when they first came out with the name, it doesn't roll off the tongue. They call it Minor Definitive Care Now. Basically, it's treat in place. We basically have a unit that dual dispatches to a low acuity call within the catchment area of University of Maryland. And if the patient agrees, they're actually treated on location free of charge by a nurse practitioner or a physician with our team. If it's a medication issue, they can call meds in. The most common issues that they're finding with the treat in place or the MDCM program, it's mostly vehicle accidents, falls, extremities, assaults, nausea, vomiting, and acute wound care. But the end result of that treat in place program is it actually saves us about 37 minutes per call. All those 37 minutes start to add up, and it actually has an impact on the system. Let me find the stats for some of that. Some of their stats. Over the last year, and you got to understand this is an annual report, so it's last year, they actually responded to 1,187 low acuity calls, of which 270 people agreed to be treated in place, which results in a good savings in time for us. They also, what we do outside after we treat a patient is 72 hours after the treatment, we actually track the patient and call them back and make sure that they didn't go back into the hospital for the same complaint. Because if they did, we didn't do a good job. And of those cases, 96% had no return to the hospital or ED, which is very successful. The only other thing I want to add with this, a lot of these programs are grant funded.
I was just about to ask that. What's your radius of execution? So you mentioned University of Maryland. I'm assuming a 1 to 3 mile radius. So Is that correct? Or
It's actually the West Baltimore catchment area. We actually run as
West
far as,
Baltimore
yeah,
catchment
so you're
area?
talking Midtown, University of Maryland, over towards Grace or
Also,
Bonds
it's
Course.
Midtown.
Yeah.
Okay.
So one, there's pros and cons with the program. One, people in East Baltimore saying, why aren't you doing that here? Which I can understand. The problem with grant funding is it goes away. I've never really, a few times I've seen the federal government offer a program to be able to sustain a program like this, an innovative program like this. They actually came up with a program called ET3 over the last year. And
Yeah,
I don't know if you're familiar with that.
Mm-hmm.
You are familiar.
I am, yes, sir.
Yeah. So basically, ET3 is going to, the CMS, or the Center for Medicare and Medicaid, are going to be able to reimburse us for calls we historically would never be paid for before. One is to go to alternative destinations like urgent care center, total health care, which is a big hub in West Baltimore, is one of our first ones we're going towards, the stabilization center. They also reimburse us for the treat and place. And lastly, for the telemedicine piece. We're actively working on the telemedicine piece right now. That's a little hard to work out. Where is the appropriate way to use that and where not? Working with university, they have a telemed hub that's coming up, and then we have to operationalize what kind of patients do we target with that. The treat and release is real nice because we're already doing it. And the alternative destination, we've already done a program with that, and we're actively doing those as well. The thing with ET3 is it's a 3-year program. It's a 5-year program.
Yeah,
We did it in 3 phases. Phase 1 is West Baltimore, which is essentially what we're doing now. And we're just getting our feet under us and learning what we didn't know. Phase 2 is East Baltimore, which is essentially your Hopkins catchment. And then phase 3, or year 3, is going to be the entire city of Baltimore. But we have to move in baby steps with that, to try to make sure we're not overstepping too much, biting on more than we can chew. But it's been very successful, and people have been, we've had positive responses from the patients that we're doing with that.
Yeah.
No,
Councilwoman.
thank you so much. Thank you so much for that explanation, Chief Max. Please let me know, being a public health practitioner myself, I would love to utilize my skills to help out with that. Definitely think that was one of the reasons why I asked that question. But I want to go back to my original question with regard to the EMS support for these particular programs. Are you all going to have some sort of pipeline for additional EMS support into these types of programs across the city of Baltimore?
That's part of what I was going to speak to. I mean,
Okay.
we're anticipating that ET3 creates a certain amount of funding. We're also looking at ARP funding as well to establish a baseline. In fact, Chief Matz has written up some outlines for that. So I think that's what partly answers your question. But I think ET3, the challenge we have with ET3 right now is we don't know what we don't know.
Yeah.
Meaning that I can't come up with an estimate of how much revenue that's going to be generated.
Okay.
In order to support that.
I would encourage you to as a baseline, using the community health worker model. That has been done at the state level as far as reimbursable opportunities for community health workers. That may be a baseline for you all to see how much it wouldn't be an accurate amount, but it would be a baseline for you all to see kind of how much money would be needed for the program, but also how much cost savings you would be utilizing as well for the department. So I'll save my other questions for the next round of questions, Mr. Chair. Thank you.
Thank you, ma'am.
Thank you. Councilman Dorsey.
Thank you, Mr. Chair. Good morning, everybody.
Morning.
I have asked about a couple of subjects every year for the last 3 or 4 years. I'm going to ask about those same things again. Last year, you reported that the department had 42 take-home vehicles. Has that number gone up, gone down, stayed the same? And I'd like to make an information request related to this.
Councilman, let's have the chief answer the question, and then we'll get the data requests after.
Thank you.
Chief Case, are you online at this time?
Yes, sir.
Could you answer the number of vehicles we have out there?
Right now we have 36 take-home vehicles.
And as I think last year, and yes, you've asked a question each year, and I think I told you that there are times that we decrease vehicles. We try to do an assessment almost every year to see who has take-home vehicles in respect to the necessity of them having it. And if we feel like there's not a necessity, we pull the vehicles in. If there's a specific issue that we have where we think we should make sure someone has a take-home vehicle, we do that. But at this time, sounds like we're 6 lower than the last time, I assume.
Great, and I guess, like you said, that could change at any time. And it's good to hear that you do try to do some sort of annual assessment. Perhaps it's more than annual. Maybe it's more frequent, ongoing. If it is the case that you might be, like you said, it might change at any time. That being said, I'd like to ask for a fairly detailed assessment of this. I'd like to have an account of how many vehicles there have been in any given year for the last 3 years. I'd like to have some pretty specific information with that. I'd like to know the individual leasing, maintenance, and fuel costs for each of those vehicles, and the individual to whom each of those vehicles was assigned and what their position is.
Councilman, I'm going to ask that you, can you type that up for me? 'Cause I
Yes,
want to
sir.
make sure, that's not one that fits in one sentence, and I don't want to mischaracterize it. So type that up, send that to me, copy Nina Themlis and Matt Stegman on it, please.
Great.
Thank you, sir.
And the second question is about Firewatch. You know that this is the other one I'm going to ask about. Can you give us a general overview of where things stand with Firewatch at the moment? And I'd like to know about 2 properties in particular, 4701 Green Spring Avenue and 300 North Charles Street. How long have we been there? How much have we spent in overtime, and how much have we been reimbursed?
So Councilman, I'm gonna jump in here. What's the question on 300 North Charles Street? Because that's in the 11th district. Is there something I can help you with on that?
No, it's just a general example that, I mean, it's a specific example of the same line of questioning I've had every year. We continue to,
Just in terms of Firewatch in general.
just in terms of Firewatch in general.
Understood. Okay.
Okay.
Chief Ford.
Yes, sir. When you say you wanted a general update on Firewatch, what does that mean exactly?
How many locations do we have Firewatch operating at? And I guess for the same kind of questions I asked about those 2 addresses, how much is it costing us, and how much are we being reimbursed for it?
Okay. Chief Reddy, I don't know if you can address how much we've been reimbursed or how much it's costing us right now, but could you tell us the locations?
Okay, we have 2 fire watches currently, both for 24 hours. 4701 Green Spring, that is a city COVID shelter. That's being we're being reimbursed 100% by the city of Baltimore for that shelter. And the other one is 300 North Charles Street. That's a multi-use commercial building. And we are invoicing them monthly. I would have to get back to you all on what they've paid.
I'd like to know not only what we're invoicing them for, but what our total costs are. In the past, we have my understanding from the several years I've been asking about this is that we've not been invoicing for the actual costs associated with it. I'd like to know how long we've been there. How long have we been there at 300 North Charles?
Okay, could you hold 1 second?
I'll jump in on that. I'm going to say August of 2020, but I'll defer to the fire department. But if my memory serves me correctly, that's when I first started getting complaints about the unexpected invoices they received from the fire department. I mean, those were warranted, of course, so.
And Mr. Chair, 4701 is in my district, so I'm curious to know as well. Remember that Kip was at that school and moved to Walbrook, and then we have the emergency separation shelter, I call it. That's temporary. And that's been there for about a year now. In fact, exactly a year.
I take Chief Reddy at his word that the department is being reimbursed 100% for that. I guess I'd like to know, it would be good to get clarity if 100% reimbursement, it means we're getting everything that we invoiced for, or whether that means we're getting, or whether there is some delta between what we're invoicing for and what our actual costs are.
Okay, we've been at Kip Academy since April 7th of 2020. And
Mr. Chair, forgive me and forgive my ignorance about this particular topic. Can the councilman explain a little bit about the context of the question so I can understand?
Yeah, let's let's start from the top. Chief Reddy, he's lead on this. Chief, why don't you first explain what Firewatch is and why we do Firewatch, generally speaking, without getting into the specifics of those two properties, and limit that answer to about a minute, if you could, please, and thank you.
okay, we institute a Firewatch whenever one or all of the major fire protection systems are non-compliant, which means they are not working. And therefore, we have to do the fire watch to ensure that the building is safe, because the alarm system's down, the sprinkler system's down, the pump's down, and then we have to institute a fire watch. Until it's refilled.
So Chief, just for a little bit of background, you correct me if I'm wrong. So for example, if the sprinkler system's not working, fire department will have someone physically on site, and the city, specifically the fire department, will invoice that property owner until they're able to get their issue corrected, in this case, the sprinkler system being fixed, and then we don't have to have someone from the fire department on site 24/7. Chief, did I say that correctly?
That's correct.
Okay. Let me go to Councilman Conway. Any other questions on the context of this?
No, that seems clear. And I guess like Councilman Dorsey's question, is that around the repayment? Are we actually?
Yeah.
Got it.
Yeah. And I only know that because he's asked this for the past couple of years. Okay, so we're on the 4701. The answer was April of 2020. What was the answer on 300 North Charles Street? I'm going to guess August of 2020.
You were close. July 9th, 2020.
Can't be perfect. Appreciate the clarification, sir. Okay. All right. All right. So back to Councilman Dorsey. You got the dates that we started Firewatch at both of those sites.
Yeah, I'd just like to know, if with what we're being repaid, what we're being repaid, and if that is a full account of our actual costs. I mean, it's similar to the way for many years we have, for many years, the police department has not billed the stadium for the full cost of police officers, right? They go out and they get billed at a fixed hourly rate, regardless of who's out there doing it and how much their individual overtime ends up costing us. And so we run a deficit on that. Similarly, here, we have not always been reimbursed for the full cost of the fire personnel who are actually performing the fire watch. Yeah.
Mr. Chair, I understand the question.
Okay, we are being reimbursed at $45 per hour per person.
But what he's asking for a comparison, so we're going to have to pull and see
Yes,
exactly what we build in comparison to what it costs for us to actually do it, the actual person, because as we move from person to person, it would change.
Yes.
I understand. Am I right, Councilman Dorsey?
That is correct. Thank you, Chief. When you send that to me, could you also just give me some statement of policy as to how long we let this go on? I mean, 300 North Charles we're on 11 months now. At some point, where is that? And I say that there was a property that I asked about last year and the year before where we had fire watch there for multiple years. How, if we're concerned about things like morale and fatigue within the department, I've got to expect that having fire officers 24/7 stationed at individual privately owned multi-million-dollar buildings for a year or more has got to be something that we need to be concerned with, when that is not what these officers should be doing in the first place. So, that's thank you.
And Councilman, I just want to contextually frame two things around your request, and then I'm going to go back and ask you to summarize your request. The first piece is, we're asking for, it's easy to ask fire department to pull the cost in terms of the number of hours and what we're billing. I think it's going to be a little challenging, so I just want to set reasonable expectations for them to pull the exact cost of putting people there, because everyone who's there is going to have a different pay rate because of rank and length of service and other considerations. So I don't, what I don't want to do is go back and ask the fire department to pull every single employee and the number of hours that employee has been on 300 North Charles, for example, and try and, get to an exact cent total. So is there a way we can give that question to the fire department in a more reasonable fashion, such as the total number of hours and the general rank and the average pay for that rank, something like that?
My understanding is that this is pretty much all overtime, so somebody should have had to approve overtime for basically every hour that a person was standing fire watch.
Chief, is that correct?
We do have access to who's worked on those days.
Okay, then you can pull the data then. Okay, that's good. The other thing is, Councilman Dorsey, I would just throw out there that obviously one option here for the city would be to say, we're simply not going to provide this fire watch service, and we're going to pull your use and occupancy, which means your building can't operate. In a situation like 300 North Charles, that would mean evicting hundreds of residents. So while I can, and I know you didn't say this, right? While I can appreciate that as one option that the city has, as I'm sure you'll appreciate it, that's a lot more complicated than, just pulling the trigger and pulling someone's UNO, of course. So I just offer that up as kind of shared context for the discussion.
Sure, and just and I totally sympathize. I understand that. Just two things. I mean, we often don't give other property owners that same deference. You lose your property if you know, it's got a vacant building notice, we put it into receivership or whatever. You know, so, but I don't want anybody out on the street, and it's good to have buildings kind of making money, you know, good business for the city. But at some point, like, there has to be something more to say, you need to get your system working. You know, I mean, at least there's got to be some timeline, right? We're going to do fire watch for up to however long it takes. That's your notice that you're going to have to start evicting people. And they, you know, the building owners don't want to evict people. They don't want to evict tenants, residential or commercial. There has to be some limitation to this program.
Mr. Chair. Mr. Chair. I just wanted to prepare you for some of the, I want to foretell what I think is gonna, what you're gonna see is we have a base hourly wage we charge that doesn't really fluctuate, primarily because we don't know. We train several people to do fire watch. We have a large number of people we train for that, but their pay is different. And I think the base pay was set on a means of what that would look like. So there's going to be times that people who get paid more may sign up, or people who get paid less may sign up. And so the number may fluctuate. And the reason why it's there is to establish an expectation of the people who require fire watch, that we could give them a general perspective of what it's going to cost, rather than that number continuously going up and down.
Totally understandable. However, any conclusion that number should err anywhere lower than the maximum that we need to, or that rather than the minimum we need to fully recover our costs, you know, setting it anywhere below what's necessary for us to recover our costs is not a policy I would be inclined to agree with, and I think that I've, you know, made that point the last couple of years.
Yes, sir, you have.
All right. Thank you all. Councilman Dorsey, you're good?
Thank you, Mr. Chair.
Thank you. Councilman Conway, and then Councilwoman Ramos.
Thank you, Mr. Chair. I've got two pretty pointed questions that should be pretty, well, maybe not easy to answer. I'm looking at Service 609, Emergency Medical Services, and just looking at the performance measures, the percentage of patients surviving cardiac arrests. The target is 42%, but the actual is 10% for 2020. Can you tell me a little bit about what's going on here? I can probably guess a little bit, but can you tell me a little about what's going on here and how this sort of talks about what you guys are dealing with?
And I'm gonna let Chief Matz, we talk about this every Monday. Chief Matz.
Hi, and good morning, Councilman. Yeah, actually, the cardiac arrest survival rate throughout the country has been severely impacted by COVID. Part of it stems from people that are afraid to go to the hospital and they sit home too long. The other problems that we're having is the amount of outreach that we're able to conduct to be able to, you know, get the hands-only CPR message out to people, you know, rapid access to the 911 system, rapid access of, you know, defibrillator device and such. That's one of the major problems. We actually, like Chief Ford had said, we've been talking about on a weekly basis with our medical directors, and we're trying to look at some different options out there. Dr. Lawner, our medical director, actually sits on a group called the Eagles, which is the top 50 medical directors around the country in the largest cities in America, and they're able to interface and do best practices. One of those we started working on is to find other ways to get the hands-only CPR message out. And one of those ways that we're doing that, we're looking at doing that virtually and recording some trainings through the public information officer, as well as with our community risk reduction personnel. We're also trying to do some different techniques in the field. You know, the days are past where when you get on cardiac arrest and you just pick up a patient and run real fast to the hospital. What's been medically proven now is that we have to stay. We basically provide the same amount of medical care you would receive in an emergency room. So we actually stay and work on people for up to 20 minutes. Did that answer your question, or?
It does. The first part of it, I think you confirmed what I thought we were seeing, COVID. The second part of actually, I'll go to the second part of this question to follow up. So with regard to the 42% goal or target, does that still sort of generally work? I mean, notwithstanding COVID in 2020, is that how do we come up with that 42% goal? It looks like we have been somewhere close to meeting in the past, but how's that sort of determined?
It's a target for it's an aspiring target for us to reach. Some places around the country actually have extremely high survivability rates, like out in Seattle. I think Seattle's on the north side is 60%. What that has to do with bystander CPR is the key to everything. When somebody falls and goes down, it's our people willing to put their hands on somebody and do CPR. They're not even recommended to do any mouth-to-mouth anymore. It's strictly hands only. And especially in large urban cities, the populations tend to not want to do that. They're also looking at some different things, working through the 911 system, where people can be alerted if there's a person drops a cardiac arrest. If all the pieces are in place, outcome is great. The other thing you got to remember is when they report that data, it's not all forms of cardiac arrest. When Seattle reports their really good survival rate, it's one particular rhythm, which is the shockable rhythm, and it has to be immediately viewed. There's a lot of different rhythms. So I don't want to get into cardiology, but you can't do anything for except medicine or other things. So it's kind of how you report it. But unfortunately, our numbers are low, as are other large cities around the country.
And there's complexity involved with us as well, because there's medical dynamics to cardiac arrest, but there's traumatic dynamics, which are extremely, extremely complicated, specifically for us.
Awesome, thank you. My second question is also with regard to Service 609. So you noted that $1.1 million of CARES Act provider relief funds will be used to support EMS personnel through December 2021. What happens when that money runs out? What will be the impact to our service?
Yep, that was the same question Councilwoman Porter asked. We are looking at other avenues as well to sustain that. It's an auxiliary service to what we do, but it's not the core operation response stuff that we do. You know, it's auxiliary to that, and we have a lot of, and to be really frank, we have a lot of auxiliary, our fringe responses are sustaining the responses, like MIHCP, ET3, treat and release in particular. That's probably going to absorb a lot of what we're talking about in respects of CARES.
Got it. Thank you. Thank you, Mr. Chair.
Thank you, Councilwoman Ramos.
Thank you, Mr. Chair. First, Chief Ford, Chief Clark, thank you so much for coming into our community in March. We also did a community walk, and I believe we gave several of my residents had smoke detectors installed, and I was really shocked, actually, that they did not have the smoke detectors. So I'm glad we were there. That was a precursor to the flooding work that we're doing as well. So I do appreciate that. Sort of in line with where Councilman Conway was going with this outcome on 609. Cardiac arrest isn't the only thing that the EMS, actually answers. So is this an accurate indicator of the performance work that EMS does? And can we actually get a better one for next budget season?
Nationally, that cardiac arrest is one of the focuses that nationally most EMS organizations focus on, but there are other outcomes out that we could possibly look at. And I will make commitment that over the next several months we'll evaluate it. In particular, like I said, I meet every Monday with my EMS chief and both of our medical directors in order to try to better do what we do. And I'll pose that question specifically to Dr. Lohner because he really has his hands on the pulse of what's going on nationally. So I don't disagree with you the fact that we should look at other things because it's wise for us probably look at specifically our needs in our community.
Yeah, that's where I was going. And also I think EMS is critical. I don't think they're auxiliary. I think they're critical to making sure that you know, people are living. Going back to my my colleague Councilman Schleifer's point, and I think he's going to keep going on that point in a minute. So I appreciate that let's look at that outcome because they do, you know, Councilwoman Middleton talked about the overdose deaths, and you know they're seeing everything, and we need to be able to talk about their immensely great performance on some of these and where they're falling short. Be able to understand where that is. Cardiac arrest is just one piece, so I appreciate that you're onto that. Totally separate question on the 911 on the improvements that you're doing on the 911. Is it also supposed to help us with accuracy? I think you recall I was looking for a constituent whose house burned, and I was trying to find him because we knew that he was around, but we were going back and forth as to what the address was. I knew what his address was, but the address of the fire that was reported was not the same address. It was actually 2 blocks away. And so when we're talking about the data that the Council Vice President just asked for, and you know, as we go through this process, we're going to need to have that accurate information, even if when somebody calls, they say 3500 block of so-and-so, and it's actually up at the 3700 block. Like, how does that then get recorded properly later on? So the question is about the accuracy going into this new phase of the improved 911.
Okay. I probably misstated something when I was talking about fringe. I wasn't talking about the actual EMS call. I was talking about the more preventive measures or more other measures that can give us a diversion of actually responding and taking somebody to a hospital. Things like education, things like not necessarily transport, but treat and release on the scene. That's more or less what I was talking about. EMS is the fire department's bread and butter as far as what we do and the necessity of us being here in many ways, and certainly not all, but in many ways. So I wanted to make sure that I didn't say that they're fringe. They are not that. They're far from that. And in respects to Next Gen 911 and the 25 cents, the 25 cents really focuses on people. It focuses on helping to support the cost that it takes of us doing business in 911 in respects to the individuals that answer the calls. I think the issue with the accuracy is not necessarily, the call is not very often doesn't come from the house that was on fire, although that's initially what's documented. Very often the call will come in and they'll say next door to my address, but they'll have to write down the address that's been given, even if it's a block away. But where you see the actual address at is on the fire report. So I can pull that actual address based upon the fire report, not necessarily based on the initial 911 call. Does that answer your question?
Okay, I think so. It's just in this case, when I was trying to find my constituent, I had to say, nope, he lives here. This is where he is. And you all were trying to track where he might be, but based on a different address. And so that's my concern, is making sure that even maybe in the back end on the fire report is also accurate, so that we have the information. You know, again, as my colleagues have kept asking for information that's location based, but if we don't know the correct address, then you know that's not going to work. So it's a little weedy, and I can follow up with you on this later if that's all right, Mr. Chair. But I think that's I think that's going to be really critical as we move forward, especially since we're asking for all this data. Thank you.
Yes, ma'am.
Thank you, Councilwoman. We've been joined by Councilman Antonio Glover, 13th District. Councilman Glover, do you have any questions?
I don't have any questions at this time, Mr. Chair. Thank you.
Thank you, Councilman. We are back to the top of the order. Councilman Schleifer.
Thank you, Mr. Chair. Chief, I want to go back to a follow-up question in response to Councilwoman Porter's questions. You had mentioned that in regards to engine, I think she said 55, and I know there's also another one, I believe, is in the 4th District. What's it? Engine 4, I think it's in the Councilmatic 4th District, that we had conversations about last year about them possibly closing, and your response was that we're still waiting on an assessment, something that it's called facets or something along those lines. And so, as far as my knowledge is that has been a long time coming. It's been in the works for a while. Have you guys received anything from facets yet, indicating where things stand based on their evaluation?
Yes, and the organization is called Facets, Councilman. That's the reason why I keep referring it to as Facets Report, just because it's the organization that's doing it. And we've received information, we just haven't received the final information from them. Thus, there hasn't been any decisions made on this area.
When you say the final, where does it stand right now?
I would argue we probably received more than 70% of the draft of the report. More than 70% of the draft of the report, but we haven't received the final report. And we have had conversations with them pertaining to some of their data, and so we can actually ensure that it's more accurate.
And so, with having more than 70% of it, what are the next steps? Are they waiting on something from you guys, or are you waiting on something from them to get to 100%?
I think right now there's some responses to them that they're waiting for from us at this time. I think that's where it laid off at last. Our challenge was they do a lot of on-site work in order to facilitate this. And initially they weren't able to do almost any of it because of COVID. So we were stagnant with them for, I know, better than 4 months. They tried to do certain things from a distance, but they said they really need to be on the ground here to do a great number of things. And that ramped up very late. So I think that was the delay, but right now I think they're waiting for some final responses from us.
All right, so being that they're waiting on stuff from you guys, and that majority of it is complete, I mean, what does it say right now regarding these two engine closures? Is it looking like that they should remain open? Is it looking like they should be closed down?
I can't speak on that because it's a total assessment of the entire organization. They're literally looking at if you move parts in the department, what happens to the entire network, because fire department is a network of a system. If you remove or move one part, it affects the rest of the city, and that's part of the conversation right now.
Councilman, can I jump in here for a second?
Sure.
The facets report, when was that commissioned?
I don't know the date right now. It's been better than a year and a half, I know.
So how long, when's the final, when do we expect the final report to be completed?
I'll try to get a date. I don't know the exact date right now.
Do you know who from your team that's on the call is running point on that report?
She's not on the call right now.
Okay. I think it would be, I'm sure you can appreciate from our perspective that when a report was started a year and a half ago and it hasn't been completed, that generates more questions than the clarification that the councilman is looking for. So I think if we could get some clarification on when the report is going to be completed.
Okay.
And I think that seems like a reasonable question at this juncture, right?
Yes.
Okay. So Nina, can we add that as a request? So we want to know when the final report will be produced and provided and I'm assuming that comes to the fire department, right?
Yes.
Okay. All right. Perfect. Thanks. Thank you, Councilman Schleifer. Back to you.
Yeah, thank you, Mr. Chair. And yeah, I mean, certainly the fact that we are in control of, like, we need to give responses, and that it seems like the fire department is the one that that they are waiting on, and those factors that certainly that loop needs to be closed up regarding what's going to happen with the future of those engines. And I'm sure Councilman Conway, who's on this call, will we'll discuss this in his committee when that report is complete. But going to that, to my next question, and this is also a follow-up question. You mentioned about having 10 peak EMS units at a time. That's what's needed. How many are currently in service today, tomorrow, yesterday?
Okay. When we stood up, I need to articulate, when we stood up 10 peak units, that's the maximum number that we can stand up based upon the personnel we have. When we established a two-tier system and stood up 10 peak units, our goal was if everybody comes to work, we stand up 10 peak units. And as we adjust based upon overtime or based upon the people that we have available, we'll stand up those units. That number fluctuates from day to day. I don't know if that answers your question.
No, it doesn't. I just want like a ballpark. Why don't we talk about, yesterday? I mean, there's a lot of violence in the city this weekend, and so there certainly was a great need in Fells Point and across the city over the weekend to have as much EMS available. So why don't we just go through this weekend, maybe from Thursday, Friday, Saturday, and Sunday? How many each days?
Chief Sabela?
Yes, sir. I'm reaching out to telestaff now, but basically the average for the peak times right now is, although it's 10, we've been running anywhere from 6 to 8 for staffing. This weekend, I have to try to get the numbers now for the exact numbers for the weekend, but generally the amount is because a lot of it has to do with people signing up for overtime for it. So, like I said, 6 to 8 is what we generally run out of those 10.
So yes, I mean, if that's something that can be looked up during this hearing, just to go back for this weekend, that would be great, and we can come back. We can come back to that.
Mm-hmm. Yep.
Is that my two questions, Mr. Chair?
Yep.
We're going to count those two, and we'll come back to you.
Thank you.
Councilman Burnett.
Thank you, Mr. Chair. The first question I had was, so in March, the Public Safety Committee passed the Fire Department's reporting requirements legislation. When is the department expecting to publish the first report that was mandated by that report, that bill?
Ms. Washington, you online?
Yes, sir.
Could you answer Councilman Burnett?
Should be publishing the report tomorrow.
Okay.
Hey, Kim, you were kind of cutting out.
You hear me, Councilman?
Yes, kind of.
Yeah, my house does not like WebEx. We should be we should be publishing that tomorrow.
Thank you. And my house also does not like WebEx. So
You
that
hear
makes
me?
it go both. Yes, yes.
Awesome. Yeah, I'll look out for that. And I guess if you could send it to, I guess, will it be sent out, or where will we?
Our plan
Make
is
sure we get our hands
to
on that.
go over the numbers after this hearing. This morning we were able to get a final compilation of the data that was requested. Going over that when we finish here, just to make sure everything is correct and lines up, and then we should be getting that report to you all, and then posting.
Perfect. Thank you. My second
Thanks, Kim.
question, thank you, Ms. Watson. My second question, Chief. So in the police department, when an employee is promoted to sergeant or lieutenant, they can be assigned to work in any unit of the organization. Currently, the fire department has about $2 million allocated to 21 management positions. Are they authorized to work in the field, Field Operations Bureau, or supervised personnel in either of those tracks? And just sort of piggybacking on the line of questioning that Councilman Sniper raised around sort of just making sure that we have enough personnel to respond to the needs of the city.
Okay. I want to make sure I'm correct. Are you asking that you're talking specifically about promotions and whether or not people can work across any of the promotional tracks? Okay. The answer for that is no, because when individuals go up a certain promotional track, if they go a promotional track into fire prevention, they pretty much stay in that track because that's what they've been trained and exposed to. That's the process that we have and the agreements we have, quite frankly. And generally speaking, I think part of the reasons why it is if you move someone up to a battalion chief of a given field, if they have no experience and not enough knowledge in another field, it's not wise to move them over to that responsibility. And it certainly is a public safety and a member safety issue as well.
Got it. Have we looked at, and just a quick follow-up, Mr. Chair, I know that was two, but has there been a assessment of the fiscal impact on not having that type of flexibility across training?
We, in certain areas of the department, we've had conversations about how we would do it, but even if we had the funding to do it, there are certain stipulations that would make it impossible for us to do it without agreements.
Got it. Thank you, Mr. Chair.
Vice President Middleton.
Thank you, Mr. Chair. And I just have, I guess, one. I noticed in Service 612, you basically reported 410 fires for fiscal year 2020. And you investigate those, the causes of those fires. Do you have data where you investigate if some of those some of the properties, I'm sure, are city-owned vacants and some are private-owned vacants? Do you have data that separates that? And I say that just so we can really see. Well, I ask this because we have so many vacant properties, and a number of them are, fires happen.
Right.
And is the investigation done differently? Can you just kind of just talk about that process, and if there's some way we can get data to see how many mayor and city council properties are, being caught on fire? Are they being boarded properly? This is a rippling effect with that other agencies are also responsible for.
Yes, ma'am. I don't know if I'm going to answer this correctly, so you'll have to let me know if I answer it for you right. First of all, we had more than 400 fires. Those are just fires that the investigator was called in because they weren't able to, the incident commander who arrived on the scene wasn't able to come up with a determination of actually how it happened, or if there were injuries or fatalities involved, then they call in a fire investigator. So we had more fires than that. We don't treat properties different, no matter what they are, you know, and no matter what they are, who they belong to, or if they belong to, if they're vacant, we pretty much try to treat them all the same, as in respects to coming to a determination and cause. So I'll have to check into whether or not I can get the kind of data that you're asking for in respects to where they are, whether or not they're vacant, and whether or not they're boarded up. I don't know, but I can pose that to our people.
Okay, and I say that because we have a systematic process where, for boarding houses for safety, whether it's a fire or whatever, and it's a different process for city-owned property, really, versus property that's privately owned, and nothing can really be done until housing does their piece, and then DPW does the boarding. So I guess, it's important. I think if we see a problem or a flaw with communication or something as we move forward. So if you have data just on, knowing that it was a mayor and city council property versus a private property, I think that would help in some situations as well,
Mr.
as
Chair.
far as safety is concerned.
Yes, ma'am. Mr. Chair, could we follow? I'd rather follow up with that to make sure I have something accurate to share with Councilwoman Milton.
Absolutely. Thank you, sir.
Thank you. Thank you.
Thank you, ma'am.
Thank you, Mr.
Thank you,
Chair.
Madam. Thank you, Madam Vice President.
Mr. Chair,
Councilman Dorsey.
I'm sorry. I wanted to answer. I've got the information on.
I'm sorry,
Councilman
Chief,
I'm
Mr.
sorry.
Chair, I don't have a question. I just got stung on my foot by a bee, so I'm going
Oh.
to take care of that right now.
Oh.
Okay, I'm not sure why you have bees in your house, but okay. Chief Ford.
Yes. Councilman Slifer asked how many ambulance units we had. On Friday, Saturday, and Sunday, we had 8 units, peak units. I didn't get a response on Thursday yet. Okay.
Thank you. All right, so we were going to go to Councilman Dorsey. He's dealing with a bee situation at the moment. All right. So let's see, we did Schleifer, Burnett, Middleton, Dorsey. Councilman Stokes. We have Councilman Stokes with us. Councilman, do you have any questions for fire? All right, let's go over to Councilwoman Porter.
Thank you so much, Mr. Chair. I did have 2 more questions related to, similarly related to Vice Chair Middleton's question related to fire code enforcement. We've been getting significant emails. I'm pretty sure many of my colleagues have been getting emails from constituents related to fire code inspections. Not necessarily, well, yeah, from a vacant housing perspective, but also from a squatter's perspective, and the squatters being there, and that them erupting into kind of like the fires that we're seeing, particularly like in District 10. Those were some of the causes that we've seen. Now, there's an increase in the FY21 target from 1455 to 2736. Can you speak to how, are there going to be additional inspectors deployed to do these fire code inspections. How are you all gonna hit that? If you share that, that would be great.
Okay. Chief, ready?
Okay, I'm here, and could
And
you?
Chief Ready, just to give you a point of reference, sir, I'm so sorry, I should have given that. I'm actually looking at the PowerPoint presentation. I'm looking at your performance measures, particularly the number of initial use and occupancy inspections, and also the occupancy complaints, fire code violations investigated within 45 days.
Okay, the initial use and occupancy is not based on us. It's based on use and occupancy is based on how many businesses want to move in the city at a particular time, and
Okay.
when for instance, that varies from year to year. So we can get 3,000 this fiscal year. We can get 1,800 next fiscal year. So that's it just varies constantly. It was down the previous year due to the fact of the pandemic. There wasn't nothing moving in the city, and that's all based on what comes in from zoning.
Okay. So my apologies. My question was framed wrong. I was getting my processes mixed up. Not necessarily use and occupancy as reflected on the PowerPoint presentation, but I did want to go back to the question that was raised by Vice Chair Middleton, like as far as vacant homes from a public safety perspective.
In respects to boarding them, or
in respects to boarding them, but also just ensuring that the BG&E is turned on, like other safety measures for vacant homes that I've seen, that from what residents have shared with me, kind of like spark fires like in the district. I'm sorry.
I'm trying to figure out how to answer the question. I really don't know exactly how to do it. I can tell you that, and I think what I'm going to speak more is on the aftermath, and I think you're more concerned about how the preventive measure to get there in the first place.
Yes. Mm-hmm.
I don't have a good answer for the preventive measure because we have a large number of vacancies. We have a large number of individuals squatting in these structures, doing everything from cooking, trying to stay warm, and other things that exacerbates that problem. And this happens whether the building's vacant or we've had a fire and we've had the city boarded up. I know I've been on community walks where we went into a structure, had them boarded up, then 2 days later we walked it and the boards had been taken off. So I don't know if I know exactly how to answer your question.
Sure.
I really don't.
And it's a very complicated question. I'm kind of asking for foreshadowing of like prevention strategies to tackle that issue. Yeah.
Councilwoman Porter, what I will tell you is this. Some of my biggest fears, because we have so many vacant buildings, is that we always have a chance of having somebody in there passing away. And because they're homeless, sometimes we don't know, or we wouldn't know based upon all the debris and stuff that happens in the structure, even though our folks go through it very aggressively. The other component is these buildings, and this is to my heart. These vacant buildings are dangerous, and I tell our members to be very careful about going offensive as far as fighting these structures, and that means actually going in the building, aggressively fighting the fire, because they're putting themselves in danger. Floors are collapsed. The house is unkept, which makes it burn a lot faster. And people have left material in it, which it makes it burn, and we don't know what's in there either. It is a dynamic issue for us and a huge concern for us. It just is.
No, thank you for that, Chief Ford. Yeah, I'd like to see if you all can begin, just from an interagency approach along with housing, DPW, and I know you all like meet pretty regularly to go through like an interagency 311 approach.
Mhm.
I would hope that recommendations actually include something related to fire safety, because for example, in District 10, we've had significant amount of vacant homes that were near other houses that had families in it. And, just by
Right.
the sheer grace of God, it didn't spread to those particular, those particular homes, resulting in fatalities. So I would encourage you all, when you're thinking through those interagency approaches, to include a fire safety measure as
Yes,
well,
ma'am.
to really address that, because most people think of vacant homes and they just think of like people not living there, but there's
Right.
also a fire safety issue
Right.
in it as well. So
I
I don't have any more questions. Thank you so much, Mr. Chair.
Yes, ma'am.
Thank you. Councilman Conway?
Sure. Thank you, Mr. Chair. I've got a question, sort of follow up on Councilwoman Porter's question, and that's with regard to, of course, Service 611 code enforcement. The performance measure percentage of fire inspections completed within 10 days received through CSR.
Yes.
Of course, in this similar conversation, a similar vein, our target is 75% completed on time. The actual is 30%, and just over time, it's always been somewhere between 20 and 30%. Can you tell me what's going on here, and why we're not quite meeting that standard that we set for ourselves?
I'm gonna ask Chief Reddy to start, and I'll follow up after him.
Okay. Our target, I'm looking for the PowerPoint. And you say our target is 70%, we're at 30%,
The target is 75%,
75%?
and the actual in 2020 was 30%.
Well, the reason why it was lower in 2020 is because you have to look at the pandemic. We could not get into most of the buildings during the pandemic for the safety of our people and the safety of the individuals.
Forgive me, Chief Reddy, but I don't want to interrupt, but I just want to sort of give you the trend here. In 2017, it was 20%. In 2018, it was 25%. In 2019, it was 30%. And in 2020, it was 30%. So we've historically been low here. Just curious if we have an understanding of why we're not quite meeting that target. Is it achievable? Or is there some other problem here that we're not quite seeing?
Okay, what I'm going to have to do is I'm going to have to look at our numbers, and I'm going to have to get back to you on this and study the numbers of the previous years, and I'll get back to you on it.
Okay, thank you. That's all I have, Mr. Chair. Thank you.
Thank you, Councilwoman Ramos.
Thank you, Mr. Chair. Colleagues, I'm looking at page 151, fire training and education, service 615. I believe my colleague, Councilman Burnett, talked a little bit about this. The outcome, 100 percentage of high school program graduates employed with the fire department 1 year later was 0 last year. Can you talk a little bit about that? And, is this a retention issue or is this a typo in the book?
Councilwoman, what service are you on? I just want to make sure I'm following in the book here.
Sure, Mr. Chair. I'm on service 615, page 151 in volume 1.
Mm-hmm. Which one again? I'm on that page. Yeah, actually, I got it.
Yep, if you go down to outcome,
Yep.
We had just talked about, or Councilman Burnett had just talked about that program, and he had meeting a couple of our graduates. And so I'm wondering if this 0, really?
Yeah, no, I got you. But let me go to Bob first from BBMR. Bob, do we know what's going on there? Is that a typo?
So I would first defer to the department if they know, because they do, they submit the information as part of their budget proposal each year. So I'm
Yeah.
not sure on that one up there.
Chief Shiloh, could you respond to that question? I do have a follow-up on that question as well.
Yes, sir. So because of the pandemic, we had no high school graduates enrolled. The very beginning of the pandemic, we lost that year's graduates, so we weren't able to hire them. So this past year, we had 0 high school graduates that we were able to enroll. That was strictly the pandemic.
So because there were no young people enrolled in the program, although there should have been, because at the end of 2020, it was the last 2 months of the school year was down, but not necessarily the rest of the school year. So you didn't get any graduates that year from
No,
that
ma'am.
program? Is that what you're saying?
No, ma'am, we did not. None of those graduates completed their CTE program. They were not able to test. They were not able to ride along to complete their EMT course. So that's why we weren't able to get any of them in.
Oh, okay. So some of the, I'm sorry, Mr. Chair, if you'll allow me, so some of the, so those folks that were, some of the young people that were in the program, just because they couldn't, none of us could go into the firehouses or go into the, go actually get the training. So were they offered the position and the opportunity to get in for this year?
So that year, no, we have those students still have not tested.
Yeah.
I have 3 graduates that are planning on graduating this year that we're hoping to onboard sometime this summer. But we've only gotten 3 for this year.
3 for this year? Okay.
Yeah.
We probably want to go a little deeper into this program because I know it is a good one, but if we're not, and going back to my colleagues, to help recruit for the program, we're happy to help. So, send us that information. But I was just shocked that there were no students that were in here during the pandemic. So I appreciate that. My second question is about recruitment in general.
Councilwoman, can I want to piggyback on that? Do you mind?
Sure.
Okay. Under good circumstances, it's hard to shepherd these young people through this program under good circumstances. And when COVID came on, it made it next to impossible because there's a certain, in order for us to do it through state EMS, there's certain guidelines we have to follow. And as we said, we weren't able to allow people to ride along in our own department. So there wasn't a large turnout of EMS and paramedics in this area or even in the state in general. And the high school, this is a situation where, the going statement is the EMS in general got a code because of the way our high school program is, they got the flu. In the sense that we weren't able to do much with them at all. And to tell you the truth, the 3 that Chief Shiloh has salvaged took a whole lot of work to get there to get them. And under good circumstances, it's a college program for all practical purposes. These are college courses that we teach them. So they're basically enrolling in college courses at the same time. And so it's a struggle in general. And this one, going through COVID has made it pretty difficult.
Okay, thanks. I appreciate that. My second question is around the recruitment and end of things. I remember I'm on the Public Safety and Government Operations Committee, so we've had many conversations about, the recruitment piece and making sure that we're recruiting women and people of color to make sure that our fire department looks like, the rest of the city it obviously, I guess, COVID has affected that, but I'm hoping that it sounded to me like it was pretty complicated where they had to, it's not only just the recruitment piece, there's also the testing and the education and then getting there, but we're still not filling these positions. So, and I don't know if this is going to be part of your report that you're going to release in the next couple of days, but it's concerning to me that it sounds like we're doing some recruitment, but people aren't getting through there. And what's happening through the process that we're not getting folks to be actually firefighters?
And as you understand, I know that you know that we hire through three different tracks coming in the department: EMT, paramedic, EMT, firefighter. We're in the process of we have EMTs and paramedics coming through the system now, getting ready to be hired. There was a long lag because of COVID. I hate to keep blaming everything on COVID, but there was a long lag because of COVID. I think Lisa Wood's on the line. Lisa Wood is over HR and finance. She's member services.
Yes,
Okay, Ms. Wood, could you explain to her some of the challenges that we had?
absolutely. Unfortunately, yes, COVID certainly impacted our EMT firefighter testing process for sure, because that test is normally an in-person test where it's a written test. So that delayed it significantly for us because we recruited in March 2020 initially for that process. So we got applications for that position, as you may recall, and then COVID hit. So we could not move forward with that testing process. We hope to be able to move forward with that testing process in the next couple of months so that we can fill those positions and move forward with that hiring process, and then fill the positions as quickly as possible. As Chief Ford just said, also, we weren't able to move forward with the EMT and paramedic as quickly as possible either, but we are moving forward with those hiring processes right now. We moved forward with EMT. We did a select service where we started with city residents for EMTs first, and then we're going to pull more from the list for other EMT applications, and we have paramedics going through the process as well. So we are, as COVID restrictions have lifted, trying to move quickly with our hiring processes right now.
And I need to point out that EMT and paramedic and then EMT firefighter, the EMS classes in comparison to EMT firefighter, all of them EMS for all practical purposes, but we can focus on hiring city employees because there are certifications that are already required in being an EMT or being a paramedic. And there's no testing or process associated with it. Am I accurate with that, Lisa?
Yes, that's correct. The EMTs and paramedics already require certain licenses and certifications, but the EMT firefighter requires the testing process, a written test.
So, because I knew that question was going to come up, we hadn't isolated the same way for EMT firefighter because of that.
Can I follow up, Mr. Chair? So if it was a written test that couldn't be administered online? I mean, I understand if it's a test where you actually have to go and, be in the truck and do, I get that with COVID, but like it's a written test that could be administered online?
We had some challenges with that because it had not been originally processed as an online exam, as well as concerns about the digital divide for city residents.
Oh, sure. Okay.
Right. So that was our major concern as well. So.
In fact, that was part of what Kim Washington worked on, trying to figure out, and Lisa, trying to figure out the impact that it would have, in particular, with Baltimore City residents because of the challenge that we have with digital divide.
It could also maybe have been proctored. Well, that's understood. Okay. All right.
We tried that too. I know it. We looked at things like Morgan, see if we can isolate them into. We really worked hard on it. I think we're coming out of it now where I think we're going to be in a position where we're going to be able to do it in the next month or so.
Well, hopefully when you report back to the committee, we can see progress on that next year, that we're actually getting our recruits up and that, we're, meeting those goals. So I appreciate it. And thank you, Mr. Chair. I'm good. Thanks.
Thank you. About to jump back to the top of the order, I believe. Councilman Stokes, are you there? Any questions for fire? Okay. We did Conway and Porter previously, right? We got you guys for round 2. Okay, perfect. Just want to make sure. All right, Councilman Schleifer.
Thank you, Mr. Chair. Chief, do you trust your executive team?
Do I trust my executive team? Yes, sir.
Okay. So why are you the only agency in the city that restricts your executive team from talking to the city council?
Sir, I have a point person. Historically, I've had a point person for people to communicate, to make sure that we have a consistent message, make sure everything's researched and it turned out properly. That's the only reason why, but I've gone through the process of opening up more executive team members in order to hold conversation with council and other people, quite frankly.
So every single agency in the city has point people that are designated to deal with elected officials. Some of them have multiple people. Sometimes there's liaisons to the council, some liaisons to the state folks. And we appreciate the work of those point people. We know that they get contacted from many different elected officials, many different hours of the day and time, and they try to be as responsive as possible, and we appreciate that. However, you're the only agency in the entire city that doesn't allow your entire executive team to take calls and speak to council people without getting prior approval from you. And so I just want to understand better why that is. We don't have that issue. The police department, you can call any major, you can call any captain, you can call any deputy commissioner, you can call any head of any agency, any part of the agency without a problem. They take your call, they try to be responsive. So I understand when it comes to messaging, but when it comes to just day-to-day operations, council people, as you can imagine, are receiving hundreds of calls and emails. And so, there's a need often to get immediate answers on specific situations or getting questions answered. And so why is your agency the only one that doesn't allow their entire team to take calls and speak to independently elected people like the city council without getting approval?
I think historically the organization has done that for more than 20 years, and to ensure that we have been accurate, gave proper information, that everything's funneled through the liaison with the council. That's to make sure that the proper person and the proper answers are given. It historically hadn't necessarily been a problem, but we have loosened it up and to other executive team members to be able to respond. But at the same time, I would hope that it would still go through the liaison of the council, so he would know what's being asked and what direction things are going. So we would get the proper answer. That's all.
So when you talk about, that it's opened up more to add more people, can you say today on this hearing that every single member of your executive team is available and approved to take calls from all Baltimore City Council people?
The answer is yes, but I would hope that if at all possible, you could reach out to the liaison to the council, and understand the executive team's only 4 people, assistant chiefs. But I don't think we've had Chief Clark is my liaison with the council. It has not been a major significant issue up until now that I know of. I'm not saying it hasn't, that I'm aware of. But yes, I'm opening up to assistant chiefs. Yes, sir. Call any of them. And in fact, I'll make sure you have the number.
Thank you. And so I'm not just referring to, I'm sorry if my definition was not completely clear. When I say executive team, I don't just mean, the deputy chiefs, like the folks that are on this call right now. Every single one of them that I've ever seen at a hearing or interacted with on the council has been extremely knowledgeable, extremely professional. And so I haven't really experienced any issue in my 5 years on the council with any member of your team that's on this hearing today. Every single person that's on this hearing today on your behalf is what I personally would define as executive team. If they're not considered the executive team, whatever you define them as is who I'm referencing. So I'm not talking about, you know, when you get on a scene of an incident, a standard firefighter or EMS person. I could understand why you would want somebody in a role of leadership to speak to an elected official to make sure the proper information is going there. But what I am talking about is the members of the team that are currently on this hearing, whose cameras are all turned on, who I'm looking at right now, scrolling through, who are all, to my knowledge, been around a long time and are the top professionals overseeing the division that they are responsible for. So is everybody on this call here authorized to take calls and respond to any questions that are asked of them by all city council members?
I would ask you again that if possible, you could go through the liaison for the city council, but I'm going to have to review everybody that's on this call because some people are people that go gather data specifically for me. So I think I'd like to look and see who's on the call.
All right, so I know that you would like us to go through the liaison, and I know that that's the desired outcome of every agency. However, that's not always the most expedient way to handle a situation or to get clarity on a situation. And just to be honest with you, when it comes to directing messages, anytime any of us, whether it be each of us in our individual council offices, you know, there's that old saying about broken telephone. So if somebody in the community calls my office and asks a question regarding a situation that occurred, you know, on a street in my district, and I happen to have gone out there and seen firsthand, and I relay that to my staff to say what I saw out there, what occurred, or what actions I plan to do, that if my staff goes ahead and repeats that to somebody else, who then repeats it to somebody else, at some point, that message is going to get broken up, and that message is not going to be as clear as if I'm the one immediately saying that. And so my question for you and my request to get clarity on, and this can be whatever request number we're up to, Mr. Chairman, is that sometime today for us to know who in the fire department is approved to take calls unrestricted without getting prior approval from every single member of the Baltimore City Council. And so I'd like to have that list, and I appreciate your willingness to provide their contact information to us like every other agency does. And so thank you for coming around and doing that. But we would like to know who those folks are, what roles they're in, their contact information, and then, you know, we can look back and see who's not approved. And then, you know, if there's a follow-up question on that, I'm happy to direct that to your liaison to find out why individual people are not on that list. But frankly, I assume that each person whose camera's on in this call, obviously with exception to your data person or to, you know, somebody's in administrative capacity, but people who are overseeing different bureaus or different aspects of the department should be able to communicate with council people. And if, you know, you want them to follow up with you or your liaison to let them know what the outcome of that conversation was, that's fine. That's internal, up to you guys. But we shouldn't have that bottleneck and extra red tape. Is that something we can get today?
So thank you for your question, sir. I'll look into it today. Yes, sir.
So Chief, I think the deputy mayor for public safety is on. So the expectation is that what the councilman's asking for, that something's going to be submitted to the council in writing by 5 p.m. today, please. And thank you. And we've kind of had conversations with the deputy mayor for public safety offline about the councilman's request. So Councilman, the request is that deputy mayor for public safety give us something by 5 p.m. today. Are you good with that?
Yes, thank you so much.
Thank you. Next question, Councilman.
Thank you. On page 132, when you look at the performance measures, it has the different targets and actuals. The first one I want to point to and ask about is you have a target of 90% of getting to EMS calls within 9 minutes. The actual was 62%. So before you answer why, you know, the actuals were so far off from the target, what is the significance of this 9 minutes? It's page 132, service 609.
Yeah. Okay. The general concept of getting rapid response EMS in general is based on a standard of concept that if someone's heart stops beating, you only have so much time in order for to possibly reverse, not necessarily reverse, but get beyond a point where the person is not viable. So the perspective is based upon that as far as EMS. And one of the things we are conscious of is that all of our people, everybody in the entire department is EMS trained. So if an engine is the first one to get on the scene, it's their job to begin to offer care and stabilize or improve the situation. They've been trained to do that. And consequently, the individual be transported to the hospital.
Okay, so just on that same note, you also further down on there have the percentage of patients surviving cardiac arrest, which honestly is the most concerning item I've seen in this entire budget process, which is that the percentage of patients surviving cardiac arrest. I think all of us know people who have gone into cardiac arrest. We know, you know, we each have known people who have survived and people who have died. The fact that the actual is 10%, that is the scariest item I've seen in this budget, that 90% of people that go into cardiac arrest in Baltimore City, that Baltimore City EMS responds to, only 10% survive. Clearly, as you just mentioned, that's a direct correlation to the number we were talking about above, about response time within 9 minutes. And so what we've also been hearing and seeing is that, you know, there's different you know, fire, you know, engines or houses that have had closures or combined resources. And you know, how do we change this 10% figure? Clearly, we need more people in EMS. I can't help but notice that on that same page, there's actually a reduction in EMS positions. There is a reduction of 1 position. How do we get that number of survival from only 10% and reverse that where 90% survived?
I'm going to have Chief Matz begin answering that question. Then I'll follow up right after him, specifically talk about the positions.
Sure. Good morning again, Councilman. Quite honestly, and as I spoke about earlier, the medical director sits on the Eagles group of the medical directors throughout the country. This is a global problem throughout the country with survival cardiac arrest rates going way down. The short answer is you got to get in front of this with a public campaign for hands-only CPR and really getting people, when somebody goes down and it's a witness cardiac arrest, the key to everything is for hands-only CPR. That's the bridge until an EMS person can get there. Once EMS gets there, then we continue with high quality CPR and rapid defibrillation. Those are the 2 biggest keys. So to change that, we have to get the mindset of everyone in Baltimore to get out there, and if somebody drops, to be able to assist with that. Along with that, we got to, you know, there's other programs through 911 where we can make availability of additional defibrillators, AEDs, automatic external defibrillators, and then there's actually phone apps that'll say somebody went down in the corner of Park Heights in Northern Parkway or something like that. But the biggest one is public education.
And we were doing very well with hands-only CPR training, especially the first initial kickoffs of it. And COVID slowed us down tremendously. And we did focus partly on the school system. Big events like AFRAM, we would set up and do training there. We've been challenged ever since, quite frankly.
So just on that, one thing that stuck into my head, and somebody here will fill me in on this doctor's name because I'm drawing a blank on it. The head of shock trauma is
Dr. Scalia.
Dr. Scalia.
Dr. Scalia. Thank you. So Dr. Scalia once said, I think it was on a TV interview, how the key to reducing the amount of lives that are lost to the violence in the city, in his mind, is on the medical end. He said there's a lot of people who are dying on the streets of Baltimore that if they got immediate medical attention within a certain period of time, or if they got brought into the hospital quick enough, that he and his team would be confident that they'd be able to be saved. And so, I just can't help but think that the fire department has, just as an integral role in reducing the amount of murders and overdose deaths and other types of deaths in the city as the police department or any other agency does. And so what I would just ask, and if this is in the works or it exists, I'd love to be pointed to it. But if it doesn't, I would ask that in the future, this is something that's taken into strong consideration, is to have a citywide plan that answers this specific issue, that deals with the specific issue of how are we going to save lives by doing the things that were just mentioned here, whether it be training, whether it be making sure defibrillators are in more places, whether it's, and of course, the fundamental piece that's necessary is more EMS members. And so is that something that your team is willing to put together in the future, a citywide plan that handles different aspects with the sole goal of preventing people who don't need to have died or could have been saved from dying?
I think, and I'll let Chief Matz correct me if I'm wrong, and I assume that you're talking about the golden hour. Is that what the doctor was referring to, Chief Matz? Is that probably what
No,
he was
I mean,
referring to?
I'm aware of the golden hour. I'm talking about more of the golden minutes. The first handful of minutes playing the most integral role in whether someone bleeds out, like what just happened in my district, or whether it be somebody in cardiac arrest or whatever the situation is. So having a plan, and that plan being all hands on deck, not just education, but also actions that can be taken by all city agencies to prevent these folks from losing their
Councilman,
lives on the streets.
Councilman, I'm going to ask you to summarize it in one sentence. One sentence for me.
Is this a plan that you guys are willing to work on?
Thank you. Chief.
And Chief Matz, you're welcome to chime in or cut me off, whatever. 6 years ago, we added 10 additional ambulances. Actually, more.
And Chief, I'm going to ask you to, as well,
I'll
be brief in the response. Yeah, we want to get OEM up next.
Yeah.
All right.
We added 10 additional units, up to 10 additional units, because I set it up that we'd have as many people as we could have and pay overtime for some. But the goal was to add as many units out there. We're starting to realize that we need more ambulances, but what we need to do is figure out ways to divert lower acuity calls away from us and away from the ER, so we can improve the resources we have. That's part of what we're working on MIHCP, part of what we're working on ET3. We're being very aggressive with that. We're also working on turnaround times at the hospital, because the less time they spend at the hospital, the more resources we have. So it's a broad-based plan, and it's out. We're working on it right now.
Yeah, Chief, I was just going to say there's two things. First of all, let's take a step back for the cardiac arrest and the trauma. There are two different distinct tracks. Somebody suffering from cardiac arrest due to trauma, they need speed to a trauma surgeon. There's really not a whole lot we're going to be able to do on the field. The medical side is what I was speaking on with education. And Chief Ford, I was going to piggyback right off where you were at. The key is to use alternative forms of transportation for low acuity. Right now, I don't know if you realize it, the state of Maryland is dead last in turnaround time in the United States. Our average turnaround time in the hospital is at 41 minutes. It drives up to 60 minutes in some cases. And that's not, we have no control over that. The hospitals are inundated with the COVID, and that's starting to go down, but the ability to throughput patients from the ED up to the floors actually has a trickle down effect on us. We're getting very aggressive with the hospitals. The state of Maryland's backing us up on some of that as well. So we're doing a multifaceted plan. One, to try to get our people in and out and turn around faster so that they're available for a higher acuity call, like a cardiac arrest or a shooting. We're also working on different programs, like you said. When we take somebody to an urgent care center, turnaround time is dramatically reduced. It's like 15 minutes to get somebody in and out of an urgent care center. Problem is, the public in general isn't aware of it, and what's the first thing they want to say? That's one of the problems we're having right now with ET3. First thing they say is, no, I want to go to the emergency room, not the urgent care center. So there's a lot of stuff in the works, but we're actively working on it.
Thank you. Councilman Burnett.
Thank you, Mr. Chair. The first question I had on this round was around Service 608, page 128. So there was around the continuum of operations compliance, which is sitting at 66% right now. Can we talk about what the plan is? How often do those need to be updated? And two, as a quick follow-up on that, what are we doing to make sure we are getting all the agencies in compliance, especially everything we've been through with this pandemic?
I'm going to divert that question to Chief Wallace.
Thank you, Chief, and thank you for the question, Councilman. Yeah, so you can see that just prior to that, there was actually a 60% in FY19 actual, and we were able to bring that up to 66% just during FY20. What we've done since March of last year is we established the vaccination prioritization work group, and what that did is that put us in the position not only as OEM but as a work group to be able to interface with other city agencies with regard to exactly this, the COOP plans in and of themselves and information that's contained within. Although this information for FY20 shows a 66% increase, that's up through when we reported this in December. A lot of the heavy lift with COOP has come since the month of January, and it extended through March. So I suspect that number has gone up. The other thing that we've done, we hired two new planners recently. One of them is focusing right now on COOP. I've also requested a total of 5 additional personnel through the ARP. Within those 5, it is my intention, if we do receive those personnel, it's my intention to take one of those and dedicate them to the emergency operations plan. The second one to dedicate specifically towards COOP. Just last week, the current employee who was working on COOP did send out an email to all city agencies with the template included there, requesting information to begin. So, the 66%, I'm pleased that we were able during a time of a pandemic to bring it up by 6%. I think it's gone higher since these numbers were reported, but I believe our plan moving forward, I know our plan moving forward prioritizes both COOP and the EOP.
And as a quick follow-up to that, where are we with the emergency operations plan? Is that complete? Is that in the last year's budget book, there was a metric around updating it. Can you let us know where we are with that?
Yeah, so, and thank you for that question also. We did start right after the March activation. We were, and I actually have Planning Chief Chris Hiles is on. He can give you a little bit of a brief, but I'll start off. We did start working on the base plan, and due to the volume of work, a lot of my planners were they were working 2 and 3 separate initiatives during COVID. The EOP was one of them. I think they've done a very good job with the base plan. They are in the process of revising it, both totally from top to bottom, but also just in the way the base plan in and of itself presents itself. We're also going to move away, and we're in the process of doing it, moving away from what are called ESFs, emergency support functions, and we're moving in towards more of a functional annex style model. So good progress so far, a lot of work to go. Chris, if I missed anything or you have anything to add, please jump in.
Yes, sir. The only thing that I would add is that in the near future, we're going to be discussing steps forward in producing planning teams amongst the members of the city agencies for those functional annexes. So as we go and rewrite them, we'll be able to have people in the room who can confirm and commit resources and have the authority to do so.
Got it. Thank you. One second. Okay. Yeah. Yeah.
Thank you, Councilman. All right, just running back through everyone. Councilman Conway.
Thank you, Mr. Chair. I actually want to follow up on a lot of questioning that Councilman Schleifer had gone on earlier about the response time and the percentage of patients surviving from cardiac arrest. It's something I think we definitely want to focus on. Mr. Chief Ford, have we been focusing on this in FireStat at all?
Internally, we've been focusing on this. This has been a weekly meeting with my team every Monday, trying to figure out how to. The backdrop of this is improving accessibility of units, and I'll go back to this. The best way to do it is try to divert some of these patients, or not transport those patients who don't need to be transported at all. And that's what we've been working on. I need to point out again that I alluded to it earlier, but Chief Matz just said it. There's a major difference between medical arrest and trauma arrest, and even in medical arrest, there's several different dichotomies, well, not dichotomies, several different algorithms of issues even in that. So our biggest issue is trying to make sure that we have units available for the call.
I think I asked that question because I would expect that CityStat and the OPI team can really help you guys to look at all of the causes and maybe hurdle points to help you work through where we can tweak and how we can get that response rate within 9 minutes up. So have we been holding FireStat?
No, we haven't.
Okay, I would really like to see FireStat back up and running. I think it'd be really helpful for you and your team to get back on the ball with these concerns. Okay, well, thank you, Chief Ford. Thank you, Mr. Chair.
Thank you. Our colleagues, just as a reminder, we had Office of Emergency Management scheduled at 11:30 a.m. We're now at 11:53 a.m. So I'm just going to ask that we make our questions as concise as possible for the fire department. Chief Ford, I'm going to ask that you all make your responses as concise as possible. Councilwoman Ramos.
My question is for OEM. Do we want to wait for that?
We'll hold off on that. Thank you. Council Vice President Middleton. All right, I just spoke to Councilman Stokes. He's good. Councilman Dorsey. All right, Councilman Dorsey is good. We did Conway.
I'm good, thank you.
All right, Dorsey's good. All right, back to Schleifer.
Thank you, Mr. Chair. Chief Ford, we've had multiple members of the department leave for surrounding jurisdictions over the last few months, and I'm being told that there's more in the pipeline. The fire department seems to be very close to having the same issues that we just faced with BPD when it comes to personnel. My understanding, and my numbers could be slightly off, you feel free to correct me, is that there are 33 paramedic, 12 EMT, and approximately 30 firefighter vacancies. And right now, I think you guys said there's 17 in the academy. We know it could take up to 10 months from hiring to graduation. So clearly there's some degree of there's a staffing issue here. How would you say the morale is in the fire department?
Let me, Ms. Wood, could you tell me, first of all, what is our what is our exodus? What is our the number of people that are leaving the department in comparison in the past? Could you tell me that?
In comparison to the past, I wouldn't say it's increased significantly. We've had some leave recently. Clearly, I think mainly, I would say, of course, it's due to COVID. The 35 EMT firefighter vacancies right now, those are mainly due to the fact that we just did promotions. If you recall, the EBD and pump operator promotions that we just did in January created a significant number of EMT firefighter vacancies. So as we move forward with the EMT firefighter hiring, as we get the testing done, that will backfill those vacancies.
Yeah, I do know this much. We've had a historic issue of people leaving us and going to other departments, but that's a historic issue. That's a long-running issue, primarily because we have a very, very busy system, and people tend to go to possibly slower running systems that may even pay more. So I do know that that has been, if there's been any dynamic to it, I know it's possibly been that. But 35 firefighter vacancies, I think we have 1,200 positions on that side. Lisa?
Correct, about 1160 suppression, so yeah.
Yeah, so that's on that end, that's not a terrible number. In fact, it's a pretty good number. On the EMS side, we're struggling because it's a smaller number, but everybody's trying to get more and more EMS people. And of course, I will readily admit, Councilman, burnout is a real deal. It's tough, and our people run call after call after call. So it's tough.
Yeah, and I did a survey 2 years ago of BPD officers. I sent it out myself, and it was directly on morale, and we found that there was a lot of morale issues. And so I think that you certainly you haven't addressed whether or not you think morale is low. It just sounds like standard operating, but I would look into that a little more and see if there are morale issues, because you're dealing with highly professional and highly trained individuals throughout the entire department. And so when people are leaving prior to, they're putting in their 20 years, 25 years, 30 years, I would just caution that there may be other factors, and that should be looked into. And so on that note, you mentioned also about different things about promoting people and other things that have occurred. And so my last question is about that. There have been many vacant command staff positions, whether it's assistant chiefs, deputy chiefs, etc., for I think it's been over a year now, that we see a lot of people in acting capacity. Are all these positions needed? And if they are, why haven't they been moved to a permanent capacity? And if they're not needed, why haven't they been eliminated in this budget to free up money for other things like EMS?
Well, they're needed, and the reason why some of them have been put in temporary status is because of the issues. I'm trying not just pointing back to COVID, but that's the fact. I had to move people around to fill other positions until we made it past some of the challenges we've had in COVID. Now, since we're starting to come out of it, I've already started solidifying some of the positions. Case in point, we don't have an actor in 911. I placed her in position. And that was a direct result of things solidifying, and as far as me having to place people to help us mitigate not just COVID for the fire department, but of a lot of logistics for COVID in the entire city. So we're coming out of it. So I'm in the process of placing positions, and absolutely I need those positions.
Okay, thank you.
Colleagues, any other questions for fire? All right,